Hey y'all, we're talking about the lymphatic system and lymphedema today. So first, we're going to first talk about is lymphatic system dysfunction. This can result because of significant physical impairments or also because of loss of function, either the upper and lower extremities. And disturbances for the structures because of the lymphatic system, this can lead to accumulation of lymphatic fluid into the body tissues. And with this accumulation, it can affect other issues and also impair joint mobility and limit daily functioning. It can be because of congenital or hereditary abnormality as well as from trauma, infection, or cancer treatments. So with managing patients with lymphatic disorders, you definitely need to be able to understand what the underlying pathology is by recognizing and knowing the different types of lymphatic disorders. This will help with managing and treatment of your patients. You also need to understand this relationship between the lymphatic and venous system. So lymphatic disorders will affect or often affect the venous system and vice versa, and which can complicate the diagnosis and treatment of patients. It's very important that you know about the use, effectiveness, and limitations of therapeutic exercise when managing patients with lymphatic insufficiencies. Now, I'm talking about more of the system and the structure and function of the lymphatic system. Its primary function is to collect and transport fluid from the interstitial spaces. This just means the spaces in between the cells and take it back to the venous circulation. And, this has a series of lymph vessels and lymph nodes. And the lymphatic system plays a crucial role in the immune function of the body to help filter out harmful substances. Now, we have some other definitions on here too, but I'm going to talk about some of this information we'll go through. I kind of looked at the Kisner and Colby definitions as well as score builders, and they're pretty similar, but we'll go through each one. So lymphatic vessels, these vessels collect fluid called lymph, and that has leaked out of the blood vessels and into the surrounding tissue. Now, lymph nodes, they act as a filter. They trap the bacteria, the viruses, as well as other pathogens that may be in the lymph fluid. Now, lymphedema, with this lymphatic system, when it is compromised, either that might be because of structural impairment or there's an overload of the lymphatic fluid. Regardless, it results in swelling of the tissue spaces. And this is known as edema. And it's a consequence of tissue trauma and the healing process. So, if the lymphatic system fails to function effectively, the lymphedema can develop and can impede the healing of wounds. It can also lead to long-term health complications. Now, lymphedema is characterized by excessive accumulation of extravascular and extracellular fluid. It occurs when the volume of lymph fluid exceeds the transport capacity of the lymphatic system. Often there'll be a water and protein imbalance. So when the capillary membrane becomes imbalanced, it allows for an increased concentration of proteins to leak into the interstitial spaces. This draws more water into the tissues and causes swelling and lymphedema. With an inflammatory response, so with accumulation of fluid and protein in this will trigger the tissues trigger an inflammatory response, and this will promote the proliferation of adipose tissue, which is just fatty tissue, into the affected area. So many cardiovascular system disorders can exacerbate lymphatic dysfunction. So with that, if it's not functioning properly, it can overload the lymphatic vessels, and this will cause them to exceed their transport capacity, which leads to lymphedema. So implications in treatment, you have to be vigilant and recognize signs and symptoms of lymphedema and be able to understand these complex interactions between the lymphatic system and other body systems, especially with the cardiovascular system. And, therapeutic exercises can be tailored to the patient based on their condition. Now, compression therapy is to encourage fluid movement from the tissue spaces back into the lymphatic system. You can get specialized in lymphedema and learn how to do manual lymphatic damage to help move fluid and reduce swelling. So with education on self-management, so educating your patient on strategies to help prevent further fluid accumulation and improve mobility. And, offering education to help them understand what the lymphatic system's functions are, why is it dysfunctioning, and making sure that you're utilizing the appropriate therapeutic interventions. This can all help manage lymphedema and improve their quality of life. So a little bit more about the anatomy of the lymphatic system. So, this system plays a crucial role, like I said, with fluid, balance, and immune system. You have lymphatic capillaries, which these are located near the blood capillaries. They are responsible for drawing fluid from the interspaces into the lymphatic system. So once this fluid enters the lymphatic vessels, it is then transported through lymph nodes to larger lymphatic trunks, and then eventually the lymphatic fluid is collected at the venous angles, where it is returned to the venous circulation. So you have what's called also lymph capillaries. So these small vessels are situated near blood capillaries, and they are responsible for absorbing fluid from the interstitial spaces. And as I mentioned before, like lymph nodes, so the body contains approximately 600 to 700 lymph nodes. The largest groups are found in the head, neck, around the intestines, and the axilla and groin. Lymphatic trunks, these are larger vessels and they carry lymphatic fluid from the nodes toward the venous system. And, and talk about the physiology of the lymphatic system, the primary components are lymphatic fluid are water and proteins. And as I mentioned, are found in the extracellular spaces. Normally the lymphatic system will transport the fluid back to the venous circulation. When you have lymphatic load, this is the amount of fluid that is transported through the lymphatic system, while the transport capacity, that refers to the maximal volume of fluid that the system can handle. So with lymphatic load, it is the amount of fluid in the interstitial spaces that need to be transported. And then transport capacity, this just means the system's ability to carry and drain the lymph fluid back into the bloodstream. And it can be affected by factors such as like the lymphatic vessel dysfunction or damage. Now, lymphedema, which occurs when fluid balance in the interstitial space is disrupted, it can be caused by two main factors. Either one, increased lymphatic load. So this is because of the venous system is unable to transport sufficient fluid, and in such cases is known as venous insufficiency. Or because of decreased transport capacity. And this can happen because of the, where the lymphatic system is impaired, especially maybe after surgery, or they remove lymph nodes, or even possibly because of radiation treatment for cancer. So types of lymphedema can be classified into two types based on its origin. You can have primary lymphedema. This type is caused by an inherent issue because of the lymphatic system structures. It can also be because of congenital or hereditary, as it could maybe be poorly developed or functions are abnormal. Secondary lymphedema, this occurs because of a result of an injury. That may be surgery, like I said, removal of lymph nodes during cancer treatment, because it could be because of radiation. This can damage lymphatic vessels and nodes. Trauma, injury to lymphatic structures that cause dysfunction, as well as infection. So certain infections can damage the lymphatic system, leading to lymphedema. So in some cases, lymphatic venous dysfunction can occur where there is a combination of lymphatic and venous system problems. This is often seen in patients with chronic venous insufficiency, and this can contribute to the development of lymphedema. So, primary lymphedema is more of a rare condition and caused by underdevelopment dysplasia or congenital malformation, like I already mentioned. And, if it is congenital, at birth it is known as Milroy disease. If it happens, if it appears before the age of 35, it's known as Praecox, Praecox. Haven't heard that one before. I mean, just early. And tarda, this type occurs after the age of 35. And with primary lymphedema is usually more seen in females. It often affects the extremities, especially the lower extremities. But it can affect any parts of the body. And if it's not properly managed, it can lead to skin changes such as hyperkeratosis and increased skin folds increases. And it can definitely worsen over time without interventions. Now, secondary lymphedema is much more common and typically results to the lymphatic structures. So common causes can include cancer treatments, venous insufficiency, infections, and trauma, and classified by the cause of the injury to the lymphatic system. So, like mentioned before, like surgery, removal of lymph nodes would be a lymphedenectomy. Sorry, talked a lot today. Which is maybe part of cancer treatment, is leading cause of secondary lymphedema. So, for example, lymph node sampling is commonly done in breast cancer surgeries to assess the spread of the disease. Also because of inflammation infection, so conditions like lymphangitis, which is inflammation of lymph vessels. Could also have lymphadenitis, inflammation of the lymph nodes, and lymphadenopathy, which is enlarged lymph nodes. This can result because of the systemic infections or trauma. And, another one would be obstruction or fibrosis. So they could also have physical barriers to lymph flow, can occur to trauma, surgery, neoplasms, tumors, or fibrosis from radiation, which leads to impaired lymphatic circulation. So with the combined venous and lymphatic dysfunction and the chronic venous insufficiency and varicose veins can cause venous stasis, which leads to edema in the extremities and presents as dependent edema or swelling that worsens when the limb is in a dependent position, such as standing or sitting for prolonged periods of time, and it will decrease with elevation. So varicose veins may cause venous distension, like bulging of the veins, while the skin may become thickened and brownish over time due to long-standing edema. With chronic venous insufficiency combined with lymphatic dysfunction, it can result in a condition known as, this one's a long one, phlebolymph edema. No, that wasn't that bad. This condition is characterized by a mix of low protein edema from the venous system and high protein edema from the lymphatic system. So it's typically present with skin changes like hyperpigmentation, pitting, swelling, especially in the dorsal aspect of the foot and toes. So on this PowerPoint slide, I have the definition for lymph. This comes directly from Score Builder, so that's the one I'm going to go with as well. And, lymph is the fluid transported by the lymphatic system, originates in the component of the interstitial fluid, and primarily consists of water, proteins, fatty acids, and cellular components. The initial lymph vessel, this is the first lymph vessel within the lymphatic system. It is the smallest vessel and is known as the initial lymph vessel. They are located near blood capillaries and are responsible for collecting fluid from the interstitium that is not picked up from the venous system. Lymph collectors are the lymph vessels that collect lymph from the initial lymph vessels, and they transport lymph to even larger lymph vessels known as lymphatic trunks. The right lymphatic duct is one of the main lymphatic trunks, and it drains lymph from the right arm and right side of the head. The thoracic duct is one of the main lymphatic trunks, and it drains lymph from all parts of the body except the right arm and right side of the head. Lymph nodes are specialized structures found most commonly in the neck, axilla, chest, abdomen, and groin, and they collect lymph from several adjacent areas and function primarily to filter waste products and foreign materials from the lymph, such as bacteria and viruses, and can provide immune system defense with the use of T and B lymphocytes. So what percentage of interstitial fluid is transported by the lymphatic system? Well, it is normally responsible for collecting 10 to 20% of the interstitial fluid, and the venous system collects the other 80 to 90% of the fluid. So as we get into the stages, talk a little bit more before that is going to be more of the clinical manifestations. And, usually locational lymphedema usually occurs in the distal upper or lower extremities, especially the dorsum of the foot or the hand. And it is referred to as dependent edema because the fluid accumulates to these distal regions of the limbs, and especially when the limbs are lower than the heart. So lymphedema can also occur in more central regions such as the axilla, groin, or trunk. So making for sure a thorough assessment of the entire limb as well as any regional areas. This is important to know about the extent of the swelling. Now, severity of lymphedema is characterized based upon the skin and subcutaneous tissue changes. It is described in 3 stages: pitting edema, brawny edema, and weeping edema. These stages range from least to most severe. So pitting edema is when pressure is applied to the edematous tissue, and where they can have indentations that remain for several seconds. So like if you put your hand on it, like let's say it's the calf or the top of the foot, you still will see your fingerprints that can remain for several seconds after the pressure has been released. Now, this reflects a significant but short duration edema with minimal fibrotic changes in the skin or subcutaneous tissue. Now, brawny edema is non-pitting edema. So when palpating the edema areas, the skin feels hard to touch, like very taut. Reflects more severe interstitial swelling, also fibrotic changes in the subcutaneous tissue. Also excess adipose tissue is typically present in this type of edema. With weeping edema, which, it's so gross. I don't like it. I don't like the weeping edema. Is the most severe form of lymphedema. And this is when the fluid is leaking from cuts or sores. The wound healing is significantly impaired in this stage. This form of edema is almost exclusively seen in the lower extremities for sure. Now, limb size and quantification. And so the severity is based upon the limb size and using either weight or girth measurements. So minimal is known as less than a 20% increase in size compared to the contralateral non-affected limb. Moderate would be 20 to 40% increase in size. Severe is more than 40% increase. So as the volume of interstitial fluid increases in the limb size, like I said, is measured by weight or girth, will increase as well. This can cause skin tightness and increased susceptibility to skin breakdowns, and can have mild, moderate, and severe dysreceptors, which is characterized by size of the limb compared to the unaffected limb. If you have a patient with lymphedema, they can have, if the skin is interrupted, say by cuts or sores, if it's clear yellow tinged fluid may leak out. This fluid is thicker and than typical vascular fluid, and this is because of the high protein content transported by the lymphatic system. And if this fluid is leaking without skin interruption from pores, this is indicative of severe lymphedema, which I've definitely seen before, leaking from the pores. Staging of lymphedema. So based upon the severity, they use stages. And so with each one of these I'm going to go ahead and go through. And they should be very similar between the Kisner-Colmate and as well as score builders. So stage 0, this stage is known as the latent or preclinical stage. There is no visible edema, though the transport capacity of the lymph vessel has been affected. For this one, for stage 1, known as reversible lymphedema stage, because pitting edema is present and increases with activity or heat, but will diminish with elevation and rest. Stage 2 is known as the spontaneous irreversible lymphedema stage. The edema is non-pitting and does not change with elevation or rest. The skin begins to demonstrate fibrotic changes, and the risk for infection increases, and they can have a stimmer sign, which is positive at this stage. So which treatment do you think is typically the least effective for managing edema associated with stage 2 lymphedema? That would be elevation of the involved limb. So the severity of lymphedema is graded using a scale from 0 to stage 3. Stage 2 is known as spontaneous irreversible lymphedema stage. The edema present in the stage is non-pitting and therefore does not change with elevation or rest. So yes, it would be elevation of the involved limb. Stage 3 is known as lymphostatic elephantitis stage. It's extensive non-pitting edema, significant fibrotic changes to the skin, presence of papillomas, deep skin folds, and hyperkeratosis. An infection is common at this stage. Stimmer sign is positive at this stage. So which of the following is contraindicated to complete decongestive therapy treatments? So there are several precautions and relative contraindications to complete decongestive therapy. That would include acute infection, if they have cardiac edema, diabetes, hypertension, malignancy, renal insufficiency, and deep vein thrombosis. Now, as an exercise program, so some patients can have a negative response to exercise, and they should be monitored and carefully through the program and gradually progressed. So low impact aerobic activities are generally recommended at the onset since they are less likely to exacerbate the patient's lymphedema. Now, what procedure is the most common cause of secondary lymphedema in the United States? So, secondary lymphedema occurs as a result of some other disease or injury, as already mentioned, that causes damage to the lymphatic system. This may be because of trauma, surgery, radiation, tumor growth, chronic venous insufficiency, or infection. So in the United States, breast cancer surgery and treatment is the most common cause of secondary lymphedema. What method is the most commonly used to diagnose lymphedema? That would just be a physical examination. So it's typically diagnosed through thorough medical history and a physical examination, though imaging techniques can be used to identify the cause of the condition. Now, which method is most commonly used to compare measurements of lymph size for lymphedema? That would be circumferential measurements. So, you can compare these measurements to the contralateral side and look for changes in lymph size, which can help determine the progression of the disease or the effectiveness of the treatment. So just as a side note too, throughout the textbook, there's different phases of phase 1 and phase 2 of intensive and maintenance based upon the swelling. And, in phase 1, you're looking at manual lymphatic drainage that is gentle and slow to promote fluid in the right direction. Another would be multiple layer compression bandaging to, use compression. Skin and nail care, like proper hygiene to avoid infections. Exercise could be active range of motion, stretching, low intensity resistance to help stimulate lymphatic flow. Stage 2 would be like the self MLD, which is that manual lymphatic drainage. Oh, I just missed my spot. Okay, through massage. Compression therapy as well. It's just worn differently, like worn during the day to maintain lymph size and multi-layer bandaging at night. And, exercise and maintaining improved fitness and using compression garments as well. Pneumatic compression pumps can be used with other, interventions, but the main criticism is that it may follow an incorrect sequence from like distal to proximal. There are different garment compression classes that I want you to look at too, because it's based upon, for mild lymphedema, it's only like 20 to 30 millimeters of mercury, and then up to like class 4 is rarely used. It's 50 to 60 millimeters of mercury of compression. Now, hyperkeratosis is thickening of the outermost layer of the skin, is typically observed with stage 3 lymphedema. I already mentioned non-pitting, but non-pitting edema is fluid accumulation that is harder and not compressible. Like when you apply pressure, it feels hard. And the stage of type of edema is observed in the later stages of lymphedema. Papilloma is a benign wart-like skin growth that is typically observed with stage 3 lymphedema. Pitting edema is fluid accumulation that could be compressed and demonstrates an indentation with applied pressure. And this one is usually observed in the early stages of lymphedema. So spleen, an organ located in the upper left quadrant of the abdomen. This is responsible for filtration of red blood cells as well as the production of antibodies to help fight infections. The Stemmer sign, this is the test used to aid in diagnosis of lymphedema. A Stemmer sign is a positive if the skin at the dorsal base of the second toe and finger can be easily lifted away from the bone, which indicates thickening of the skin due to fibrotic changes. The thymus is an organ located posterior to the sternum and anterior to the heart that produces T cells and T lymphocytes to help combat infection. And you can also play this Quizlet for fun. Well, that concludes our lecture over lymphedema. Have a great day.